Hi, my name is Dr. Erica Latcher, and I got the call no horse owner wants to get. My horse was colicking. And unfortunately, Ernie needed to go to colic surgery. I thought I'd use this opportunity, though, to walk you through the process a bit about how I made the decision to go to surgery and what colic surgery is actually like. First off, how did I know he needed surgery? His heart rate was extremely elevated during my initial exam, and he was blowing through sedation incredibly quickly. I would give him sedation, and 20 minutes later, he was back to being very, very painful. His palpation was pretty normal, and his lactate, a blood test we do, was also very normal. However, on ultrasound, he had a few loops of distended small intestine, and those loops had a thickened wall. Ernie is a cribber, so this led me to believe that he probably had what's called an epiploic foramen entrapment. The epiploic foramen is a tiny hole that is formed by the liver, the stomach, and the pancreas. And in cribbers, for some reason, the small intestine likes to go through that hole. It can only be fixed surgically, so it looked like we were going to be heading to surgery. Luckily, I had thought about whether or not I would take Ernie to surgery before this, and he is on my list of horses that would go. So we made the decision, we hooked up the horse trailer, and we were off to Equine Medical Center of Ocala for a probable colic surgery. Once we got there, Dr. Adams continued to do a lot of the things that I had done on my workup to confirm that he did need colic surgery. They also did additional blood tests, which showed that, along with mine, that he was systemically pretty okay. We needed colic surgery to fix things, but he wasn't sick yet. And that's a really important thing when it comes to anesthesia. Lots of people have asked me if I was scared about anesthesia, and I wasn't. And that's because Ernie wasn't sick. And we've made leaps and bounds in the last 25 to 30 years with anesthesia and surgery in general. I wasn't concerned about Ernie surviving the surgery. I was more concerned with a few things afterwards, but I'll tell you about those in a moment. This is how we get horses from the induction stall and onto the surgery table. They don't just get on the table willingly. So you have to hoist them up by straps on their feet. And then they're wheeled out on a beam, basically. And then he's going to be placed on the table. I'm going to spend a little bit of time on the table making sure that he's perfectly straight to try to minimize pressure spots, because he's going to be upside down for a few hours. While they're doing that, they're also going to start scrubbing his abdomen for surgery, and anesthesia is going to set up some monitoring equipment to be sure that he's in a good place for surgery. Again, here we are in the surgery room, and the anesthesia crew is working to set him up on their monitoring stuff, heart rate, blood pressure, all the same things that you see in a human surgery suite you see here. He's also going to get scrubbed again and again to try to make everything as clean as possible. I'm going to drape him in a large sterile field. Everything you see that's blue is sterile on the top side. And that's to reduce the risk of infection, which is a very real risk in horses. They're just not a clean critter, as anybody who owns them knows. They frequently are just dirty. There, Dr. Adams is even going to switch gloves before he starts surgery so that he's got a clean, fresh pair on. Now he's going to start to do the incision. Because Ernie was likely small intestine, we put the incision a little far forward. If he had been more large colon, it probably would have been back a little bit farther. But we went with a forward incision since we all believe that it was highly likely he had an epiploic. There's the cecum. That is the first thing you look for when you make that incision. It's an important landmark. He's going to follow the front of it down to the small intestine and the back and side down to the large colon, just to tell them where things are going. They're going to suction the gas out of it once they use it as a landmark, and that'll give them a little more room to do surgery. Here, Dr. Adams has his hand down on the epiploic foramen and is in fact confirming that there's small intestine going through it. As you can see, it is very, very, very deep down in there. They are up to their armpits in there. And the next part of this process is going to be about 45 minutes of trying to get that intestine through. What I'm really worried about here is, what does the intestine actually look like? And so I'm grilling Dr. Adams from the surgery suite on, does everything look okay in there? He's telling me it is, but until I can see it for myself, of course, I don't believe. So there you can see he's got one hand on either side, and he is pushing small amounts of small intestine through and pulling them from the other side. This is an incredibly delicate process. You can't just yank on it because there's a lot of important structures involved. So after doing that for about 45 minutes, we had all of his small intestine out on the table. And by we, I mean Dr. Adams. I was mostly just standing there watching. So there is all of his small intestine. It's nice and healthy and pink, and that is absolutely what we want to see. We don't want to see dark red or purple. That would have meant that he needed a resection where we had to take a piece out, sew the ends back together, and that increases a lot of the post-operative risks of colic surgery. So luckily we didn't need those. And finally, we are closing the incision. They're going to use an antibiotic-soaked suture to try to minimize the risk of infection of the incision. There'll be a bandage over the top of it for recovery, and then once he's in the stall, he'll have a belly bandage on to, again, try to reduce that risk. This is one of the biggest complications post-surgery for horses. So you guys are all worried about whether or not they can survive the surgery, and I'm worried about all the stuff afterwards. So it tells you how far we've come. But here's my big concern, recovery. While we have had we've overcome almost all of the difficulties of anesthesia and surgery, waking horses up is still the hard part. Unfortunately, they stand on those 4 sticks, and they're not very good at standing on those legs when they're drunk. So, as you can see, this is a big padded room. They've given Ernie some sedation to slow down the waking process. But I was the most nervous for this part. So until Ernie stood up, I was just standing outside the stall pacing up and down, which took about 45 minutes. But here we go. There's Ernie standing. He's going to hang out in here for a little while until he's got his sea legs under him. And then they're going to take him back to a stall. But I can't tell you how happy I was to see this. It's about 2 a.m. at this point, and like I said, that was a very happy sight for me. Once he's back in his stall, he's going to be on some fluids, small meals starting in about 48 hours. He'll have ice bags on his feet to try to prevent laminitis. You can see he has a belly bandage on there, and he'll just be closely monitored for side effects post-surgery. After about 3 to 5 days, he gets to come home where we do a lot of this. We're going to spend the next 3 to 4 months working on returning to normal. Luckily, Ernie colic during summer, so we have a lot of grass at home for him to eat, and that was the best thing for him to eat post-surgery. There's a couple things that I would take away as the moral of the story here. For one, I wasn't nervous about surgery because we made the decision quickly. I knew Ernie was healthy enough to survive the surgery itself and anesthesia, and that's really important. My workup, Equine Medical Center's workup and surgery confirmed there wasn't any dead bowel, so that means that we're likely to have a really great recovery. And I thought about surgery beforehand, and I cannot overemphasize that. Think about what you're going to do with your horse before it's time to make that decision. And now I get to enjoy my pony.